Chapter 8 discusses the vitamins that are required for our calcified structures. What are vitamins? They are catalysts for all of the metabolic reactions in our body that use proteins, fats, carbohydrates for energy, promote growth, and cell maintenance. And some of those vitamins that are required are our fat-soluble vitamins, which are vitamins A, D, E, and K. And then our water-soluble vitamins are all of the B vitamins as well as C. The requirements for each of these vitamins vary based on age, gender, people that are taking medication. Sometimes that can affect their absorption of these different vitamins and changes their requirement. Those that smoke or use tobacco, many times that can affect their requirements if the body's under stress and what is the patient's health status. That's why it's really important for us not to make recommendations to the patients on amounts. That should be done by their physician or by a nutritionist or somebody licensed to do so. But we definitely can lead them to the choosemyplate.gov so that they know exactly where requirements should be and what nutrients they should be taking in daily. A deficiency is an inadequate amount of a nutrient, and it has to be to a level that affects the body's ability to sustain its functions. Some of the groups of patients that might be at risk for this would be patients that are going through rapid growth, medically compromised patients, of course, patients with substance abuse issues such as alcohol, tobacco, or even methamphetamine, those with psychological or physical stress, and then vegans because they don't take in any form of animal product. So there are some vitamins that we'll talk about that can be affected by. Vitamin requirements. One way to remember vitamins is that they are vital to life in minute amounts. So we don't need a ton, but we do need enough for our body to sustain life. The requirements for most vitamins, especially the water-soluble vitamins, increase during periods of stress due to the elevated metabolic activity, and therefore we're using more of those vitamins. A primary deficiency of a vitamin would just be due to a nutritional deficiency due to decreased intake. A secondary deficiency is a vitamin deficiency due to an inadequate ability for the body to absorb or use the vitamin, an increased requirement for whatever reason, whether it be disease state, growth, such as pregnancy, things like that. Maybe our body isn't excreting properly, and so those vitamins are building up in the body, or there could be due to destruction of the body. We're going to talk about the fat-soluble vitamins first. These include A, D, E, and K. They are soluble in fat or fat solvents. They are fairly stable in heat, so if you're cooking, the heat doesn't break down the fat-soluble vitamins like it can the water-soluble vitamins. Organic substances, which means that they all contain carbon. They are absorbed in the intestine along with fats in the foods. They are stored in the liver and fat tissues. Fat-soluble vitamins require bile for absorption. Bile is made by the liver and secreted by and stored in the gallbladder. These vitamins are transported through the lymphatic system. So some of the characteristics of water-soluble vitamins, they are also organic, but the B vitamins all contain nitrogen. They act as coenzymes, meaning that they help our body's enzymes perform the jobs that they're supposed to do. The B vitamins, as well as C, are absorbed in the jejunum, which is part of the small intestine. And water-soluble vitamins are not stored per se. Fat-soluble vitamins are stored in the liver and some in the muscle tissue, some in fat. But the water-soluble vitamins are stored in very small amounts, so it is important for us to get B vitamins and C every day. Vitamin A is also known as retinol or carotene. The retinoids are obtained through animal products, and the carotenoids are through fruits and vegetables. And I just always remember that because of carrots. I always think of carrots when I think of vitamin A, and that they help your vision. That is true. A deficiency in vitamin A can lead to night blindness or the inability to see very well in dim light. Vitamin A is important for growth. It's important in the synthesis of our DNA and our RNA, bone, as well as tooth development. It is important for the integrity of skin and epithelial integrity of mucous membranes. It helps us to maintain our immune system, and it can be associated with cancer prevention. The different requirements for a 900 micrograms of retinol for men per day and 700 micrograms for women. And there is a tolerable intake of 3,000. Now remember, with the fat-soluble vitamins, you are more apt to become toxic by overdosing on a fat-soluble vitamin because it is stored in the body. Example, vitamin A can be 90% of our vitamin A is stored in the liver, and it can be stored there for up to a year. Whereas the B vitamins or vitamin C are flushed out every day through our system. So it's harder to overdose on a water-soluble vitamin than it is for vitamins that are fat-soluble. Some of the sources of vitamin A are milk, cheese, liver, butter, eggs, fortified foods, and then yellow, orange, and green leafy vegetables are a really good source as well. If I am low on vitamin A, it would be under nutrition, which could lead to infections. It can cause keratinization of the mucus-forming cells, xerophthalmia, which is dry eye, or night blindness. The normal function would be proper maintenance of that epithelial tissue, proper immune function, and proper night and color vision. If I am over or hypervitaminosis, it can lead to redness of the skin, fetal malformations, dermatitis, bone malformation, hemorrhages, bone fractures, liver toxicity, and then death. So you can see this chart kind of goes from the very lowest to the very worst possible scenario with intake of vitamin A. Large amounts of vitamin A supplements can exceed the storage capacity of the liver. And again, there's a list of what can occur with hypervitaminosis A. And here are some images of the dermatitis, what can happen to the cornea, as well as the gingiva. Maternal consumption of vitamin A supplements before conception and then during that first trimester have been associated with fetal birth defects. So it's important not to overdo these vitamins. If a person takes in too much of the plant form, you can get an excess of the carotene, and actually their skin turns deep yellow or orange, especially on the palms of the hands and the soles of the feet. Here's an example of what that might look like. For low vitamin A, you can actually see enamel hypoplasia or defective dentin in developing teeth. Again, the night blindness, the dry eyes, Biddett spots, which are those pearly spots on the conjunctiva, and that would be an advanced deficiency. It can cause growth restriction in children, and again, keratinization of those epithelial tissues that line the lung, the GI tract, and the urinary tract. They can become more susceptible to infections, the hyperkeratosis of the skin, and then in the worst case scenario, death due to toxicity. Vitamin D is also a fat-soluble vitamin. It's called a vitamin, but it is classified often as a hormone due to its roles. It is important in calcium and phosphorus absorption. So vitamin D, calcium, and phosphorus kind of all work hand in hand to help each other be utilized efficiently. Vitamin D is also thought to be involved with cells of hematopoiesis, which is the formation of red blood cells, involved in the skin formation, cardiovascular function, as well as our immune response. From age 1 to 70 years old, it is recommended that we have 15 micrograms, which is 600 international units, and 10 micrograms is 400 international units. So there's like a conversion that you can do. Once we reach 70, they increase the daily requirement up to 20 micrograms. Many times elderly people aren't out in the sun, which is the best source of vitamin D for our body. So many times we become deficient, and more in discussing this with my physician, they're routinely checking women now for vitamin D deficiency, and most of us are deficient in vitamin D. So that's one thing that we could encourage, especially women as well as men, to get checked and make sure that they're getting enough of that. The estimated average requirement intake to prevent rickets, which is the deficiency that we see in kiddos, is 10 micrograms or 400 international units. And the American and Canadian diets do not provide sufficient vitamin D, like I was saying, so sunshine is the best source. Make sure those levels are checked and that you're getting enough of vitamin D. Some foods that provide vitamin D are fish liver oils, fatty fishes. Many of our foods are fortified, such as milk, cereals, and orange juice, and you can take supplements. I would, again, refer to a nutritionist or your physician to make sure that you're taking something that is quality and going to be absorbed efficiently by your body. Absorption occurs best when all of the nutrients are present in sufficient quantities in the body. Remember, I said vitamin D works very closely with calcium and phosphorus, so if you are deficient in calcium and phosphorus, your absorption of D is not going to be where it should be. Also, fiber can affect the absorption of vitamin D. So diets that are high in fiber can result in less vitamin D absorption. So for those people that are on high fiber diets, they probably need to bump up their vitamin D either by getting out in the sun for 10 to 15 minutes without sunscreen or by taking some sort of supplement. Too much vitamin D can lead to toxicity. If a patient were taking synthetic vitamin D supplements or, say, cod liver oil orally in large amounts for 6 weeks, toxicity signs might be nausea, vomiting, poor appetite, weight loss, constipation, dizziness, weakness, and then tingling sensations in the mouth. Like I said, rickets is the deficiency that we see in children. We see this most commonly at the distal ends of their radius and ulna bones in their arms. And these deformities result from the bones kind of bending at that shaft junction. Enamel hypoplasia and dental decay, and also periodontitis can be seen in these patients. In adults, we call that osteomalacia, and this is decreased bone mineralization or softening, which can lead to deformities of their limbs, their spine, their thorax, as well as the pelvic bone. Symptoms are skeletal pain and muscle weakness, and in an X-ray, you might see a loss of that lamina dura. Some of the physiological roles of vitamin E are: it is an antioxidant. It can protect polyunsaturated fats and the phospholipid cell membranes. It prevents oxidation of fatty acids. You'll see vitamin E in a lot of the face creams and things like that that we use due to its antioxidant benefits. It's also an anticoagulant, so it can lead to blood thinning. It can enhance the release of prostaglandins, which can inhibit the aggregation or gathering of those platelets that can cause clotting. It also can enhance vasodilation and immune responses. So if a patient is taking like warfarin or Coumadin or aspirin therapy, they really want to watch the vitamin E because it's going to have the same effect. It's going to be an anticoagulant as well. Requirements for vitamin E on a daily basis are 15 milligrams per day, with the upper intake level being 1,000. And then I've got the conversion units there for you so you can kind of understand what those levels mean. Some sources of vitamin D. We get vitamin D from our vegetable oils, especially soybean oil. Many times it's in unprocessed cereal grains or even fortified cereals, nuts and seeds, wheat germ, avocados, green leafy vegetables, some of our fruits are good sources of vitamin E. The absorption and excretion of vitamin E. Unfortunately, absorption of E is very inefficient. Only 20 to 80% is absorbed in healthy individuals. The efficiency of absorption will depend on the body's ability to absorb fat, which as a person increases their vitamin E intake, it declines the amount that they're able to absorb. Evidence is inconclusive that vitamin E actually helps with cardiovascular disease and other chronic diseases. Higher doses of vitamin E can actually disturb the balance of beneficial natural occurring antioxidants, so we're not sure that it actually does reduce cardiovascular disease. Some individuals that might benefit from vitamin E supplementation would be premature infants, children, adults who can't absorb fats and oils. The naturally occurring vitamin K, it can be found in green plants, and it's called phylloquinone, and that's K1. And then menaquinone is K2, and that's actually formed by the bacteria in the large intestine, by the E. coli bacteria. Vitamin K, and it's the last of our fat-soluble vitamins that we're going to discuss. It functions as a coenzyme for proteins that are involved in bone crystalline formation. Vitamin K, I always think of the word clot and spell it with a K because it is a catalyst for the synthesis of the blood clotting factors like prothrombin. So opposite of vitamin E. Vitamin E has anticoagulation effects. Vitamin K has blood clotting effects. The requirements for K are 120 micrograms per day for men and 90 for women. Great sources of K are green leafy vegetables and meats. The shortage of vitamin K is unlikely because it is derived from food as well as the microflora in the gut. And the bacterial flora in the jejunum and ileum synthesize vitamin K. So that's that E. coli bacteria I was talking about. And they provide half of the body's requirement daily. Here is a chart showing you some good sources for vitamin K as far as foods go. Vitamin K absorption can decrease with high levels of vitamin E supplementation. Some vitamin K is stored in the liver, and 30 to 40% of vitamin K is absorbed and excreted via the bile through feces as well as water-soluble metabolites. So we can have hyper and hypo states of vitamin K. A primary vitamin K deficiency is uncommon because typically, like I said, we get it through foods and our gut, the bacteria in our gut is producing it. So it's highly unlikely that we would not get enough in our diet. Secondary deficiency would be due to disease or drug therapy that can affect our ability to absorb, such as a patient maybe has a condition that's blocking bile flow, such as celiac disease or sprue, ulcerative colitis, hemorrhagic disease of a newborn. So that is why when babies are born, oftentimes they're given a single dose at birth to prevent hemorrhage, because when a baby is born, they don't have that clotting factor yet. So they'll give them a shot of vitamin K because, again, it is that blood clotting vitamin that will help them if perchance they would have a problem or need surgery or anything like that, to help their bodies produce the prothrombin and things they need to cause their blood to clot. Adults with poor dietary intake who have undergone trauma, extensive surgery, long-term parenteral nutrition with or without treatment of antibiotics. And then drugs such as anticonvulsants, anticoagulants, some antibiotics, especially cephalosporins, salicylates, and megadoses of vitamin A or E can all be causes for hyper or hypostates states of vitamin K. We are going to discuss vitamin C in this chapter. Remember that vitamin C is also called ascorbic acid, and it is water soluble. The reason they have included vitamin C in this chapter is because vitamin C is really important dentally. It's important for collagen synthesis. So and it's an antioxidant. So when it comes to the structures that support our teeth, vitamin C is very important, but it is a water-soluble vitamin. Vitamin C enhances the ability of the body to absorb iron. It also aids in the use of folic acid and B12. And like I stated, it is an antioxidant. It can promote the integrity of the capillaries. And it is a coenzyme in the metabolism of amino acids and the biosynthesis of bile acids, thyroxine, epinephrine, and steroid hormones. Requirements are 90 milligrams a day for men and 75 for women. Now, if you're dealing with a smoker, a lot of times a nutritionist would recommend that a smoker up their amount of vitamin C a day for collagen production and healing, because smokers, as we know, have a decreased ability to do so. Sources are citrus fruits, tomatoes, raw leafy vegetables, strawberries, potatoes, and sweet potatoes. Low vitamin C, again, would lead to delayed wound healing, poor bone and tooth development. The deficiency disease associated with vitamin C is scurvy. I always think of the pirates out on the ship, and the reason they developed scurvy was because they didn't have good sources of vitamin C on those ships out at sea. So it only takes about 20 days of deficiency of vitamin C for a person to start showing signs of scurvy. The symptoms of scurvy are red, swollen gingiva, a sore, burning mouth, gingival friability with spontaneous bleeding, periodontal destruction and tooth mobility. They have an increased risk for candidiasis and infection, and malformed enamel and inadequate dentin, depending on where they are in tooth formation, what their age is. So scurvy can be pretty aggressive and pretty quick, but the good thing about scurvy is it can also be treated. If a patient starts taking or getting a good intake of vitamin C through fruits and vegetables and things like that, you'll see the situation turn around. If providing it hasn't gone too far and they've actually lost bone and had some irreversible damage. But if we catch this in an early stage, we can quickly reverse it. Marginal intakes of vitamin C. If someone isn't getting quite enough vitamin C in their diet, they're going to be at a little bit greater risk for periodontal disease. And then smokers, if you throw that in the mix too, they're at another higher risk for periodontal disease. But deficiency of vitamin C does not cause gingivitis or periodontal disease. It can be a contributing factor. We hopefully all remember that the cause of gingivitis or periodontal disease are the bacteria.